Mrs. Gillespie, tell me more about how you spend your day. Who do you talk with, or who do you see during the week?
Oh, Mr. Pratt, you don't have to stand there waiting. Please have a seat. When we're ready for you, someone will help you to and from the exam room.
I'm sorry, Mrs. Johnson. I may have gone over everything too quickly. Would you like me to go over this information again?
Mr. Murdoch, your chart says that you're making progress, but you look a little sad. Are you okay?
Mrs. Williams, some people like yourself who have a weakness in their legs have difficulty doing things around the house. Do you have someone who can help you around your home, if and when you might need it?
By the year 2030, 1 in 5 Americans will be over the age of 65, and the fastest growing group is people aged 85 and older.
As a healthcare provider, it's important to not only understand the challenges that these older patients have, but also to be aware of the resources available to you in the local community to help meet these challenges.
Healthcare providers may find that an older patient's needs extend beyond medical care into the social determinants of health. This can include home safety concerns, social isolation, and not having the right caregiving supports available. These factors can all have a significant impact on the physical, mental, and emotional health of a senior. In these cases, finding the right services for patients can be a daunting task for healthcare providers. The current system of agencies can seem complex, and oftentimes the eligibility processes are not user-friendly.
Fortunately, the INconnect Alliance can help. The INconnect Alliance is comprised of 16 aging and disability resource centers throughout Indiana. We are committed to helping you find the information and resources your older patients need as they navigate the complex care puzzle and system of long-term services and supports. Our goal is to put knowledge at the seniors' fingertips. The more seniors and their loved ones know, the better decisions they can make. Aging and Disability Resource Centers, also called ADRCs, are designed to be highly visible, trusted local places where seniors, people with disabilities, and their caregivers can get free information and assistance, regardless of their income level. The philosophy behind Indiana's ADRCs is to empower older adults and persons with physical disabilities to have greater control over their quality of life. This is accomplished by providing information about and assistance with housing search options, food needs, transportation, assessments and applications for federal and state-funded programs, legal and medical needs, state health insurance assistance programs, counseling, and a variety of care and support services for older adults and persons with disabilities. ADRCs help individuals who are planning for their future care, as well as healthcare professionals seeking assistance on behalf of their patients. Option counselors at these ADRCs are trained to assess existing or anticipated long-term care needs. Based upon those needs, the options counselor explains the full range of available programs, options, service providers, and resources within your community. ADRCs are a valuable resource for healthcare providers. By integrating ADRC resources into your interactions with patients, you may be able to provide senior patients with the best possible care. Knowledge of these outside resources can often help you deliver a streamlined, whole-person approach to patient care. You can connect with the local INconnect Alliance to request information for your patients, and you can encourage senior patients and their families to reach out by phone, walk-ins, or appointments, as well as online referral for options counseling and long-term services and supports, or through the INconnect Alliance website. By highlighting the many resources available through the INconnect Alliance, you can help improve your senior patients' overall quality of life. Within our rapidly aging population, there are several common health issues that are on the rise, and there are a number of ways that the INconnect Alliance can provide assistance.
According to the Alzheimer's Association, 1 in 3 senior adults dies with Alzheimer's disease or another type of dementia. In fact, these diseases cause more deaths than breast cancer and prostate cancer combined. As the number of older Americans rapidly increases, so will the number of new and existing cases of Alzheimer's disease.
So, Mrs. Moore, I'm here to go over a few discharge instructions and help you get ready to go home. That would be good, wouldn't it?
Yes, it would. I'm not home now, am I?
No, this is still the rehabilitation hospital.
Yeah, Mom has been more confused lately. I'm not sure if she's really able to go home.
I understand. You know, the INconnect Alliance has counselors that can help you with possible options. I think it'd be a good idea for you to give them a call.
You can help a family navigate their care decisions by referring them to an INconnect Alliance counselor. A local INconnect Alliance options counselor can talk with the family about their specific situation. Often, the counselor can help the family take a step back and assess a senior's current condition, including the senior's cognitive and functional abilities. The INconnect counselor also can facilitate a discussion to review the home and determine if any modifications may be needed, what community services may be available to help, and what care family members may be able to provide. This will often help determine if the senior should be discharged to his or her home, and with what level of support, or possibly to a more appropriate setting, based on current condition and functioning.
Everything looks fine, Mrs. Richards.
Good. I feel fine, I think, for someone who's 91.
We should all be doing as well as you when we're your age. Have you noticed anything out of the ordinary with your mom?
I think she's doing well, but she seems a little down lately. She doesn't get out much anymore. Other than me, she doesn't have many visitors. Most of her friends are ill or they've passed away. She seems lonely and depressed. But I guess depression is normal for someone who's 91.
Well, even though depression is common, it is not a normal part of the aging process, and it can be successfully treated. Why don't I test you with the depression scale? And I can put you in contact with the INconnect Alliance. They may be able to connect you to services to help you and your mom.
According to the World Health Organization, over 15% of adults over the age of 60 suffer from a mental disorder. The most common mental disorder among seniors is depression. But depression is not a normal part of aging. In fact, studies show that most older adults feel satisfied with their lives, despite having more illnesses or physical problems. However, important life changes that happen as one ages may cause feelings of uneasiness, stress, and sadness. Symptoms of depression that you may notice in your senior patients include feeling down, depressed, or hopeless, loss of interest or pleasure in doing things, significant weight loss or weight gain, slowing down of thought and reduction of movement, fatigue or loss of energy, diminished ability to concentrate, feelings of worthlessness or excessive guilt, recurrent thoughts of death or a suicide attempt. Local INconnect Alliance options counselors can help seniors and families overcome problems associated with lack of mobility and social isolation. For instance, counselors can help connect seniors and their families with community centers and other places where seniors can socialize and participate in activities that interest them. Options counselors can often help with transportation solutions as well.
Each year, millions of seniors, those 65 and older, fall. According to the Centers for Disease Control and Prevention, each year more than 1 out of 4 seniors falls. Many of these seniors become afraid of falling, even if they're not injured. This fear may cause a person to cut down on their everyday activities. When a person is less active, they become weaker, and this increases their chances of falling.
Well, nothing's broken, but you do have a severe bruise of your tibia, and you've had a couple other falls over the past year.
Just clumsy, I guess.
But it's those stairs that are giving you the real trouble, Dad. We're just concerned that if we don't get a ramp installed soon, he's gonna fall again.
That's a valid concern. The INconnect Alliance may be able to help you get that ramp. I can get you that contact information.
Local INconnect Alliance Options counselors can visit seniors and their families in the home setting and help assess their specific situation. Counselors can provide practical recommendations on ways to make the home safer. By referring seniors to an INconnect counselor, you can help them find ways to reduce hazards that may be endangering their health. Conditions in the places where people live affect a wide range of health risks and outcomes. These are known as social determinants of health. For instance, poverty often limits the access to healthy foods and safe neighborhoods. As a caregiver, you may often be among the first to recognize that these factors may have a negative effect on the health of a senior. Local INconnect Alliance Options counselors can assist seniors and their families in identifying possible solutions. By referring families to their local INconnect Alliance Options counselor, you can play an important role in protecting or improving the health of senior patients.
A senior's needs should be assessed on a regular basis to help them maintain their quality of life and also to help support their caregivers when applicable. A great tool to help you assess the situation of a senior loved one is the Activities of Daily Living, or ADL checklist.
Well, thanks so much for taking the time to explain everything to us.
Yes, I feel so much better now that I understand what was going on.
I'm glad I could be of help.
Is there anything else we need to know?
Well, since we talked about the possibility of some cognitive decline, I'd like to talk about the Activities of Daily Living checklist with both of you.
Okay.
This ADL checklist will just help your son assess how well you're doing and where you might need some help in the future.
The ADL checklist focuses on 5 key areas. It helps you evaluate the person's personal hygiene, such as the ability to take a bath, groom themselves, and brush their teeth. It includes an evaluation of the ability to make appropriate clothing decisions and physically dress and undress oneself. It looks at the ability to feed oneself, though not necessarily the ability to cook. It evaluates the ability to maintain continence and looks at both the mental and physical capacity to use a restroom, including the ability to get on and off the toilet and cleaning oneself. And the checklist looks at how capable the person is to move from being seated to standing, getting in and out of bed, and the ability to walk independently from one place to another. In addition, there are instrumental ADLs, that is, self-care tasks we need for everyday living. These tasks require more complex thinking and organizational skills, and include things like managing finances, transportation, meal preparation, and medications. Depending on whether an individual can do these activities on their own or if they rely on a family caregiver for assistance can help you determine their current level of independence. Reviewing the ADL checklist can also help identify areas where the caregiver could use some added supports. Based on the answers provided through the Activities of Daily Living checklist, areas are identified where seniors might need assistance. Again, the INconnect Alliance Options counselors can help seniors and their families identify options for the assistance they may need, and caregivers can gain valuable information and support.
Always feel free to contact your local INconnect Alliance counselors and ADRCs. They can provide you and your staff with information to share with senior patients.
And as you assist your senior patients, remember to consider and be aware of social determinants of health that may affect senior patients. Ask senior patients about any environment, socialization, and community interactions that may affect their overall health and wellness.
The INconnect Alliance is here to provide a resource to you to help meet the needs of your patients and guide seniors and their families towards the right services and supports to enhance their quality of life.
Thanks for watching.